This is possibly the most significant moment in a mother's life.
Good job, Aaron.
Fewer women than ever in Canada are delivering vaginally.
Fantastic.
C-sections are on the rise for a variety of reasons, including women having children later in life. C-sections represented close to 19% of births in 1997. 15 years later, a quarter to a third were C-section deliveries.
Can we reduce our section rate?
4 years ago, this hospital's obstetrics department was over budget. Then 1 in 3 deliveries was a Caesarean section. A surgery Dr. George Arnold says costs more than delivering a baby vaginally.
Is that the best use of healthcare dollars when we don't have an unlimited pot to spend?
He's managed to reduce it to 1 in 5. He did that by delaying induction of labor, among other things, including by getting women who had a firstborn by C-section to have a vaginal birth in subsequent deliveries. Women who have had multiple C-sections are mostly responsible for the high rate. 2 weeks ago, Lisa Seltzer delivered her baby vaginally despite having her first by C-section.
And had a very, very quick, successful natural VBAC, exactly how I wanted it the first time.
There are hopes that her experience will become more common. Ontario hospitals are now being told their C-section rate might even affect their budgets. More funding for hospitals with more vaginal deliveries. Dr. Arnold will head an Ontario task force to look at the issue.
In an effort to not only provide the best care we can to the patient, but to be fiscally responsible as well.
Obstetricians we spoke with say there's pressure to decrease C-section rates, in part because the World Health Organization says a C-section rate between 10 to 15% is ideal, much lower than Canada's at 25 to 30.
The problem comes when there's an attempt to chase a specific number.
Dr. Magnus Murphy is the president of the Alberta Medical Association's section for obstetricians.
A woman should have the right to choose whatever delivery and birth she wants.
Seltzer agrees it shouldn't be about dollars and cents, but about what makes the most sense for an expectant mother and baby. Stephanie Matisse, CBC News, Toronto.